The next question is from Charlie Angus, please.
Thank you, Mr. Chair. Thank you, Madam Minister. Very pleased that you're here today. And I only have 7 minutes, and there's so much I want to talk about, so I don't want to sound terse. And I don't think it's an issue of talking about what's happened in the past. It's what's under your control that we can change. We lost a young man today. We lost a 13-year-old boy 2 weeks ago. We had 99 attempts in Manitoba in one community in Shamattawa. And every time I talk to people, they tell me they don't have the frontline workers. They don't have the ability to track to see if children are being protected. So on November 1st, you and all of us voted to flow that $155 million shortfall immediately. So what does immediate look like to get it to those frontline agencies?
So first of all, thank you for the question, and thank you, as I have before, on your very important work and advocacy around these issues, and I look forward to your further input on and good advice. So you've actually kind of mentioned a couple of things together. One is around mental health resources and the human resources to support that, and then you've also talked about the response to the Human Rights Tribunal, because that was
flowing the money. Yeah,
flowing
the immediate.
The money.
What does immediate look like to get that money out?
Immediate obviously is as soon as the money can get out the door, and so you've heard some of the responses from my colleague, the Minister for Indigenous and Northern Affairs, but I want to say that on the matter of Jordan's Principle, which was one of the features that the Human Rights Tribunal spoke about, I'm very pleased that we were able to get funding to be able to fully enact Jordan's Principle in the order of $382 million. That has actually been very effectively used by my department, and Sunny can give you details, but at last count we know 900 children have been assessed. So there is, the money is flowing, the work is being done, and kids are getting the care they need.
Well, according to Cindy Blackstock's, it's frustrating saying she may take you to court because you haven't implemented the full Jordan's Principle. You've implemented your interpretation of Jordan's Principle, which is short-term crisis, children with emergency needs. We have doctors who came here last year and said children were dying. They were falling through the cracks every single day because of racist, that's their terms, and discriminatory policies by Health Canada against children. They wrote to you in September and said that your policies were racist and discriminatory, and yet those policies are still in place. So you might help 900 kids who have special emergency needs, but these doctors are saying your policies are hurting kids. So why have those policies not been changed?
I think that it's important to note that there have been changes in the approach, and I think that the work that's been done to date has been helpful. I am not going to say that that within healthcare systems across this country that racism and discrimination does not exist.
No. This is about your department. So let's give you an example. We've got a 2-year-old boy. Doctor says that boy needs an audiology test, and one of your officials says it's not necessary. That wouldn't happen in any medical system in this country except under Health Canada. Do you think that that's acceptable? Why is that policy still there, that one of your bureaucrats can override a doctor's prescription?
So I don't want to respond to the specifics of a case that I don't know the details about, but I can tell you that we are absolutely committed to the full implementation of Jordan's Principle. We have put the money and the resources behind it. My department,
Okay, so the issue then is 2-year-old boy turned down for an audiology test, not by the doctor, by a bureaucrat. So if that policy is still in place, that is still discriminatory. So in terms of the denial of services to children for mental health services, or the delays where kids have ended up falling through the cracks, do you track them? Because what we hear is that Health Canada turns down or says go to Indian Affairs says go to Health Canada. Did you track those cases?
So, Mr. Angus, I would encourage you and any of your constituents and others that for whom you are advocating, and once again, I congratulate you on advocating. I don't think we do anybody any favors by blaming officials who are working very hard to address the system. That's not to say that there's not room for improvement. It's not about blame, but do you keep records of these children because you're responsible for them?
Does
You
your
know what?
department track them?
If there are specific cases, I would like you to bring those to my attention and speak to me at any time, speak to my officials.
Okay.
If
Well,
there are
I'll give you an
particular
example
case-
because we had your chief executive director at committee, and I asked him that question. He said, of course we track. Of course. If they need service, we track that. I said, would you pass those records over to our committee so we know? Is this hearsay or not? And he said he would. So that's committee testimony is like speaking on the record. You have to be truthful. But when I asked your department said they don't track. So just because you don't track children that falls through the crack doesn't mean you're not responsible for them. So my question is how can you then make any kind of financial planning if you're not actually tracking the denial rates of children who are needing these services? If you don't track, how do you know?
It is my understanding that any requests that are made are that there is a tracking mechanism to respond to those, and if there's evidence to the contrary, I look forward to hearing that. I can perhaps ask
So
Mr.
would you
Perron-
give, I don't need names, I just want to know what are the percentages, because I note that in terms of denial rates in special orthodontics, it's gone up to 99% appeals. Now we have that on record. Why don't we have the denial rates for children needing mental health services who are facing potential risk of suicide? Do you have it or don't you?
I'll ask Sunny if he wants to comment in terms of whether that's available.
So the access to mental health services, I believe you referred to the mental health services under the non-insured health benefit. So every individual that is a First Nation or an Inuit person have access to coverage for a certain number of sessions every year. So
Yeah, I know,
in
but
theory, there is
people are
no-
told time and time again that it doesn't exist. So I asked your official, do you track? He said yes. Do you have the statistics? He said yes. Then I said, would you give them to us? And he said yes. So we contacted your department and we were given a letter saying you don't have any of these records. So how can you tell us that you're actually looking after these children if you don't bother to track and yet you tell our committee that you do?
If I can answer this one, we don't track denial because under this program, everybody is eligible.
So everyone's
to the
eligible, but if
section-
they don't get served, then they fall through the cracks.
But the service is coming from private provider. We don't necessarily have a tracking of if people have asked for these sessions or have seen the providers. We confirm that we will be covering the cost.
That's like a form of systemic negligence if you
I'm
don't
afraid,
actually know.
afraid I'll have to leave